my God, I love that intro.
Oni!
And now I have Jim is joining us, the inimitable Jim Pickett.
It is so jazzy.
I actually was behind the scenes like this.
I was too, and I thought, okay, maybe do a little bit here, but not too much. We don't want to scare the people who are here with us today, but it's so great to be here with you, Oni. The last hour was so interesting.
It was. We covered a lot, like vaccine confidence, trust, community voices and long-term survivor, everything. The cure research, it was great.
And now we're talking about research advocacy.
Yes.
And maybe I should probably introduce myself since I haven't done that yet. Although maybe you want to reintroduce yourself for the new hour, and then I'll come after you.
Sure. Dr. Oni Blackstock, I'm coming to you from New York City, where it is 3 p.m. And I'm a primary care and HIV physician, and wear a number of other hats. And I'm so excited to be here with Jim Pickett, who I love when I get pings from my email account. Because I'm like, I know it's Jim sending stuff from the choice agenda. So thank you for keeping me informed and our community informed.
Oh, thank you, Oni. And Oni, you're a multi-hyphenate and brilliant and genius in so many ways. But one of the things I think I love about you most is you're such a fierce advocate. I'm such a fangirl, and I'm so glad to be here with you talking about community research advocacy. My quick thumbnail sketch, I've been doing prevention research advocacy for almost 3 decades, really focusing on rectal microbicide research and PrEP and a number of other things. And then I'm also a person living with HIV. And so my very first entree into HIV therapy, I only was able to get onto HIV drugs through a study. I was in an early protease inhibitor study. I was insured, and I didn't have access to meds. Like, my insurance didn't cover prescription meds, only in the USA. Crazy. So so much to talk about in terms of advocacy and centering community. And I think we probably want to bring on our 3 speakers and have them introduce themselves, and then have a look for a great discussion.
That sounds great, Jim. Okay, they're popping on screen now.
Look at
Hello,
this.
everyone.
Hey.
Hi.
Hey, should we stop? I'm not sure how the screen looks. Should we start at the left-hand side and go we would start with Dr. Diallo and then move? Oh, now Jim, now you're
bumping around. I think we will follow whatever you say, okay. Oni. And I think starting with Dazon is probably a good idea.
That was one of the energy I was getting. So hi, Dazon. We're so grateful to have you.
Hey, y'all bring so much light and spirit and energy and love to this conversation. I am just so happy to be here and be a part of it. Hey, y'all.
Hey.
Hello. Hey.
And so, Dazon, do you want to tell us just quickly, what's SisterLove and your integration with community research? Not the entire bio, but the thumbnail sketch bio.
Sure. Yeah, because with 42 years under my belt, y'all don't have this hour go live.
We don't have time for all that.
So, hey, everybody, Dazon, Dixon, Diallo. I'm founder and president here at SisterLove. We're a 36-year-old sexual and reproductive justice organization based in Atlanta, Georgia, and also in Johannesburg in South Africa. And it's interesting because we started in this work thinking that we were, or at least I did, I'm going to use I and we, those are both my preferred pronouns at the moment, that we started in this work just creating stuff in community that we thought would work in the way of prevention education, engagement, helping people, women, Black women in particular, living with HIV. And lo and behold, as we developed our own interventions, our own solutions, it turns out that those things didn't matter to the people with the money. Those things didn't matter to the people at the CDC. Those things didn't matter because we had no evidence behind our work. And so the way we jumped in was, first of all, advocating for ourselves that the work that we were doing had to be researched in order for us to demonstrate the evidence, and so that we could be included in the science itself. And so that's why I have been a research advocate since almost the very beginning of SisterLove, which means almost over 40 years. And lo and behold, that community engagement in research and in advocacy has absolutely advanced so much of the success in the science that we see today. And that's what I'm happy to talk about.
And thank you, Dazon. And how about we go to Mary next?
Absolutely. Well, hi, everybody. Mary Woolley. I'm joining you from Washington, D.C., which actually doesn't look anything like this background. I'm just borrowing an office. You all know what Washington, D.C. looks like. What it feels like is another story right now. And we'll talk about that. So Research America is also Dazon, 36 years old, and it was started to assure that research for health, broadly speaking, including for HIV/AIDS, fighting HIV/AIDS, became a higher priority on the public radar screen and importantly the policymakers' radar screen. And we have been working in that vineyard with some success, some setbacks ever since. Personally, Research America, by the way, is nonpartisan, not-for-profit alliance of organizations. So that means academic institutions and independent research institutes, patient groups of all kinds, including those with a special focus on HIV/AIDS and rare diseases and American Heart and everything else, professional and scientific societies of all kinds, and pharma, bio, medical device industries. And finally, foundations that have a major stake in assuring that we can make more progress in health by putting research to work at the level it's capable of delivering. And we all know we're not quite there yet. My own background was honed in the 70s and the 80s in San Francisco, first with a large prevention trial in heart disease, actually. And then in the 80s, when I was the CEO of a research institute, that, of course, was the most devastating decade for HIV/AIDS, or the beginning of the most devastating part. And I learned a lot about advocacy. I'll talk about that.
Great. Okay. Thanks so much, Mary. It's wonderful to have these veterans in the field with tons of expertise. So this is going to be a thrilling conversation. So we'll move on to Dr. Benjamin.
Hi, everyone. I'm George Benjamin. I'm the executive director here at the American Public Health Association. I'm an internist and an emergency physician. And of course, APHA has been around since 1872. So we recently celebrated our over 150th year. But actually, I'm sitting here in New York City at a celebration a little later this evening with the New York City Health Department for their 220th year. So as you can know, public health has been around a long time, and we've been in this business for a long time. And I'm really excited about being here today.
Well, thank you so much. And I'm actually annoyed that I wasn't even invited, because a few years ago, I was leading our city's response to the HIV epidemic, and I was at the New York City Health Department, but I'm there in spirit and supporting all of you as you celebrate the legacy of this health department. Maybe I'll throw it over to Jim, because I've been on for an hour, so I'm like, you're nice and fresh. So I'm going to let you maybe start us off, and you're just you are the hostess with the mostest.
Well, I think I don't know. I mean, you have a lot of love online, so the hostess with the mostest award is going to be a tough one. Although I'm willing to compete for it. So
or we could just share. We could share.
Yeah, I like that. I like that. So first of all, thank you all for being here. And there is so much to dive into, but I wanted to just start with, first of all, just noting that we've been talking about HIV research, and HIV research has been the centerpiece of today, but we've also heard how foundational, intersectional it is, and how it really connects to all kinds of disciplines. So I think we should feel free to talk about research advocacy, with an HIV lens, but also how that influences other spaces. At this time, and where we're, Mary brought up, you've all brought up this world we're living in, this crazy world we're living in, and the amount of challenges and barriers that are being thrown our way, terminations of networks, of support, erasing of identity. Never has it been more important to be engaging in advocacy in support of research. And what is the centerpiece of advocacy but community? So how do we make sure, this is out to all of you, how do we make sure that we are engaging communities now, it has to feel very confusing and frightening and overwhelming. And so how do we take something that's so big and so overwhelming, billions of dollars lost, so many studies stopped, programs ended, how do we make that accessible to communities, so how we can actually engage at the personal, local level? I'm going to throw it out there, and whoever wants to take that can pick it up first.
Ben, I think, Jim, if I understood you correctly, you're asking how could communities, everyone in a community, get engaged to be advocates. I know that that's really what's needed. That's what happened early on, or maybe not the very beginning, but that's what turned the corner for HIV/AIDS was activists in San Francisco, for sure, and elsewhere, who demanded that research be better funded, demanded that progress move faster, and they convinced not just Tony Fauci and others then in the government, but they convinced the public. And the public was deeply afraid at the time, as you remember. It actually reflecting on that time, as I tried to put my thoughts together for today, I thought of how much it really is like the beginning of the COVID epidemic. People were deathly afraid. Word death was often used and felt. And it takes research as that gleam of hope that helps people get past the darkest thoughts and the darkest hours. And of course, we lost a lot of people to HIV/AIDS, and we lost a lot of people to COVID, but we saved many, many more. So I like to use the frame then, now, and imagine. So it won't take but a minute here. So then, you remember back in the day when AIDS, and it was originally just called AIDS, when AIDS was a death sentence, period. I, as the parent of pre-adolescents, was terrified about their own sexual activity, what they were thinking about, much less what they were doing, and they were doing. And so was everybody else, terrified. The people in the organization I was the CEO of were terrified to come to work because we were isolating the virus. We were mistakenly, now this is one of those disinformation things, we were mistakenly all over the media for isolating victims, patients of AIDS. Can you believe that? With footage with me talking about leading this institution, doing great science, and having footage of the Holocaust running in the background. Very irresponsible. Fortunately, those were just a couple days stories. They went away. We got a lot of support. But meanwhile, employees were dying, friends were dying, the list goes on. That was then. Now, the next part of the then, now, and imagine story. Now, thanks to investment in research, thanks to activists, thanks to the communities coming together, thanks to members of Congress, thanks to presidents, we have HIV/AIDS as a manageable chronic disease, still not perfectly resolved, of course, but we got to that point. But imagine, and this is where aspiration comes in, imagine that we put HIV/AIDS in the history books where it belongs. That kind of power going from then, now, and imagine is something you can talk about without data for those who don't know how or care, and there are a lot of those people, about what the data shows. They want to be reassured that actions and policies are based on evidence, but they don't really want to look at the data. And that could be members of Congress that don't want to look at the data, but they can sure relate to this then, now, and imagine. Imagine that aspiration for better, for solutions, for prevention has not gone away, and nobody runs for office on a platform of shutting down research for health. They just don't.
So true. And I love the then, now, imagine. What a great construct. I'm going to lovingly steal it, Mary Woolley.
Please do, please do. It is your.
You know what's funny in that, Jim and Mary, is that on
You're going to steal it too.
Well, actually, this is where the alignment comes in.
Okay.
My own construct was then, now, and next. So, I mean, that has been the language inside my podcast. And so I'm already loving this alignment. But what I wanted to add to that question, if you don't mind, Jim, I think what's critical is to know where different populations were in this research trajectory that we're talking about. And when I talk about being an advocate, a lot of that was because I'm an old act upper, and I was a rare act upper. I was a Southern heterosexual Black woman in the AIDS space. And so sitting at certain places and tables, I was a fish out of water. What I know about then was that you had communities of people who had an immediate effect, an immediate impact by their friends, by their loved ones, by their playmates, by their people that they lived and loved in their everyday lives, who were dropping off the scene, who were dying. And that gave a different kind of impetus. We didn't see that in the same way, for example, in women, in Black communities, in rural communities, even in the same way. And so coming into those spaces and not having the language, not having the research knowledge was a detriment. It was a disadvantage for us. And so a large part of our trajectory has been learning. Research literacy has been and always will be really important for community engagement, because that's the only way people are going to truly understand the power of being involved in clinical data or clinical trials and studies, truly have a desire to be directly involved in designing protocol, in determining what informed consent should look like for their own communities and their own and for themselves. And so learning has been an important part of this process. Earning your place at the table has also been an important process, building the capacity in our communities to directly engage with community organizations. I believe that community engagement in and of itself belongs in community, by community, for community, and with community. And in order to do that, you need to make sure that the organizations are capacitated and resourced to be at those tables. And then the last part, learning, earning, and yearning, is that we also have to know what it is that we want in the studies, from the studies, and because of the studies. And so there's a pathway that in the HIV research world, we have been able to articulate that, we have been able to demonstrate that, and we have seen major shifts in how studies get conducted, how they get written up, and how they get implemented because of community engagement. And that's a piece that can never be missed. And the advocacy for those shifts have always been the center point of how we reach those endpoints.
Yes, mic drop. That was really powerful, Dazon. And for Dr. Benjamin, I'm also wondering for you, what lessons relatedly from other public health advocacy campaigns can be applied or can inform the HIV research advocacy that is happening now and that is so critically needed?
Yeah, public sentiment is everything. And in the bottom line, the short term is we make noise. You educate the public, you let them know what the risks are, and then you make noise. If you think about it, that's working every time we want to get resource allocators' attention. Whether it is the body bags outside the Philip Morris building for tobacco, whether it was the hacked up activities, the taking over buildings, it was the peaceful resistance, whether it was disability advocates coming up to Congress on Medicaid. It's about educating the public, getting the public engaged, and making noise, and letting them know that they're wrong in cutting research. They're wrong in undermining progress. They're wrong in not allowing us to imagine the future. I think that's the best way to do this. And now it does require someone to sit down with these folks and organize it and collaborate. But we've done it for many, many, many years. We know how to do this. We just have to do it.
Thanks for that, Dr. Benjamin. Should I jump in with a question, Oni, or did you have a follow-up for him or someone else?
No, Jim, I was just, one thing I was curious about, because I know we've kind of talked about research and we talk about advocacy and community, and for a lot of us, it's all interwoven.
Yeah.
And I was wondering if Dr. Diallo could just speak to, like, I know your organization, SisterLove, you all are engaged in research, you partner in research, and wondering how sort of the current climate has affected you all, and sort of what are some things that are keeping you sort of chugging along and going.
Thank you, Oni. You know, what's interesting is when you're in community and the targets, at least in this moment, the targets for research have been these really big institutions and these big studies, we sort of roll under the radar. And I'm going to say that in a way that I hope doesn't pull us into the target space. But when I say we've been able to roll under the radar, is because at some point, you don't stop talking about what studies can do and what they have done. You can't stop ever doing that, and we haven't, right? And so for us, directly engaging in the studies has meant, for the research we're already partnering up with, we did everything we could, even when things were dropped offline. There's been some impact in terms of a loss of funding for some time. Slowly in some spaces, especially in particularly not in prevention, but in cure and treatment research, things are coming slowly back online, and we have not left that space. So dedicated to doing what we do, whether there's big resource support for it or not, is a part of that strategy. The other thing that I think is important that we've been able to do is go outside public funding space and look for research dollars for community-led research in other places. And we have been a little bit successful in that because we're a reproductive justice organization. That means when we look at our work from an intersectional standpoint, we can tie in other types of questions and other types of research that we've been doing at the local and community level. I wanted to draw in that we've also built things for ourselves to make sure that community engagement is sustained and retained. Things like, and I'm just going to lift this up, I'm sure AVAC is going to get all their flowers throughout these 24 hours, but good participatory practice is still a real thing. It can still be taught. It can still be partnered up with in terms of institutions that still have research ongoing. It could also be a way to continue the work of doing community literacy for scientists and researchers the way we do research literacy for our community partners. Another thing that I think is important to bring in is that by having created community advisory groups, boards, councils, you now have an entire community of people who are invested in so many different ways in continuing to advocate for the research that's happening in their own communities and sometimes in their own lives. And we have consistently held those conversations even in the midst of the silencing of some of the research that's been affected by the changes this year. I want to remind people that community, I almost want this tagline that says, particularly in HIV research, community did that, right? So when we talk about good participatory practice, community did that. When we talk about bringing in new ways to provide guidance to include pregnant people, people who don't want to be on highly active contraceptives to stay in HIV research, community did that. When we talk about making sure the intersectionality matters, addressing people's needs and concerns so that they can participate in studies in the most robust ways with the least obstacles possible, community did that. And when they talk about making sure that there's equitable representation in science, like representation for the people who live in the margins, for folks who are least likely to be addressed or reached out to be included in research, we created rubrics to make sure that scientists had to justify excluding people. Community did that. And so there are building blocks that we have built for a long time that we could still be using now in the advocacy to restore any of the science that we've lost across all different disciplines and areas of study. This is the clarion call at the end of this particular struggle to restore our community, our research community to its fullness, is community did that. And remember, there are a lot of different communities within our one HIV research community. So we can all say it together. Community
did that.
Yes.
I'm going to pass it over to Jim, but just to say that was powerful, and we're getting Dazon for president comments in the chat. So just want to make sure that you are aware of that. But it speaks to the importance of self-sufficiency, self-determination, building our own outside of institutions. So no, it's very powerful. Jim, I'm going to pass it to you.
Thanks. Yeah, there's so much here to get excited about, and Dazon always gets me riled up. So thank you for that, Dazon. Something that's been riling, I think, a lot of us up, and all of us up since January, is the erasure of members of our community. And I want to be just really specific. There's been such detrimental efforts to erase the existence of trans people, anti-scientific, absolutely crazy, not based in reality. We know trans people exist, but now we're taking them out of our data collection. We're pretending there's only two genders. And, and frankly, the thing that really strikes me is that HIV research is one of the first places that transgender people finally started to get a toehold and some respect after years and years and years of fighting. And now that's being torn away. So I think I'm going to look to our non-HIV folks on the panel first, just to say, trans people and people of different genders exist in all kinds of ways. HIV is hardly the only thing that is of concern to these communities. In fact, HIV is often not a concern at all to transgender people. And so how do we make sure in these times that when we're doing community advocacy, that we're engaging folks that Dazon mentioned before that are on the fringe, maybe now even harder to reach because of these official silencing and this pushing away and pushing underground? How do we make sure that those voices and those participants and those people continue to be at the center of everything that we're doing? So Mary or Georges, you take whoever wants to
Sure,
that one.
I can start. I think the first thing we have to do is reject the concept that diversity, equity, and inclusion is discriminatory or reverse discrimination. The research cuts to DEI and gender identity programs was devastating and also illegal, which is why APHA sued the administration on that point. Diversity means that you have the population that's important to understand the problem. If we know very clearly that communities of color and women are historically underrepresented in almost all aspects of research. We also know that inclusion functionally means looking around the room and seeing whose voice is not there, and then reaching out to them to get that voice to the table to achieve equity as a central tenet to doing good research and make good data-driven decisions. So I think the first thing we have to do is we have to reject completely this concept that somehow DEI and gender identity is improper. And we need to do that with all the fervor that we have. Okay, that's very important. We have to demand that funding gets restored. We have to demand that the research community that's doing that research is diverse, is inclusive, that the institutions that are doing that research are diverse and inclusive, and that they engage community at the conceptual stage of the studies, not when they're ready to, do the selection of participants. And then, of course, when those studies are published, those engaged community members need to be authors. They need to have the right to help review those papers. And then we need to leave something in the community on a long-term basis. If it wasn't for the HIV collaborative groups we already had in place to do HIV research in the community, we would have never been able to do COVID research on the COVID vaccine. So these research collaboratives have a multitude of benefits, co-benefits, because what they fundamentally do is build community trust and engagement And we have to keep those research networks warm. And one of the things that is happening with these research cuts is they're destroying those networks as we speak.
Mhm.
And those networks are hard to rebuild.
That's right.
Yeah.
So
Yeah.
I couldn't agree more, Georges, with the points you just made, and to underscore the importance of ending this atmosphere of cuts for all the reasons that have been stated here. It is possible to stop those cuts in their tracks, and we've made a lot of progress in that regard, far from over the finish line, I might add. But there is progress, and it shows that advocacy works. When people who are concerned about a problem get together as individuals, as communities, ally themselves to speak with one voice, the all the negative impulses and moves can be halted, truly halted in their tracks. And right now, literally right now, is the time to be talking to everyone's members of Congress about the critical importance of keeping the NIH budget whole, not making cuts along the lines that the president has requested. Those are being ignored, by the way, by the Congress, by across the aisle in a bipartisan way, and in both houses. But it's not across the finish line. Again, this is something everybody can weigh in on. Can also weigh in on the importance of keeping PEPFAR alive. We can weigh in on the importance of not turning our backs on years and years of strong and useful research that has helped keep the benefits of research available for everyone. And I will say the current and the previous director of the NIH and the current director, Dr. Bhattacharya, has only been in place for a few months now. And the previous director, Dr. Monica Bertinoli, was not in place for very long. But both of them had and have rock solid commitments to the benefits of research reaching everybody. And they don't make exceptions for one person or another, one community or another. I have not heard that rhetoric, nor do I believe that it would be consistent with their work as academics or in other roles in their background. So we have to work with them. They're not the enemy. Those who would tell us otherwise just have to be taken on, and there are plenty of voices that can take them on. We need to get organized and do it.
Thanks, Mary. Over to you, Oni. Do you have a question? I know there's also a question in the chat for Dr. Benjamin.
That's fine. No, I was just going to say, I know
Sure.
Your question was specifically about our trans siblings, and again, in these moments like this, I mean, this is the case all the time, but we must we must follow what trans communities are saying they need, because trans communities know what they need the most, and so there are many organizations that are actively doing work that have been doing work for years. And so I think also supporting and partnering with those organizations, because, nobody sort of knows what the experience is more than people with lived experience. And so just wanted to add that in, that some of this is, we need Congress, but there's a lot of community grassroots work that's happening as well in parallel, and it can be synergistic.
Oh, I so agree. And I really think of, like we always say, all politics are local.
Yes.
I mean, all like research and community, it's all local.
Yes.
So, do you have a trans organization where you could go and volunteer or serve on their board or support them in some way? Do you have a BIPOC organization that needs their help? These are the organizations that are at the intersections of all these challenges. And as I was trying to say earlier, like everything can seem really big and hard to grasp. But if we go local, there's a place down the street from you, right, that could use your help. And this is a little bit of a segue. It's broadening it out a little bit, but it is about what individuals can do. And Dr. Benjamin, are there any actions, this is from the chat, are there any actions or calls to action that the APHA is encouraging us to take? Is there anything we can elevate or amplify through this event today and through our website?
Oh, call your member of Congress today. Write a letter to that member of Congress today. By the way, they count them. When you call on the phone and leave a message, they count those. And the number of calls they get, that gives them an idea of what the sentiment of the public is. If you write a letter, it's even better. And when you're a constituent, I mean, when I go in, they know what I'm going to say. I'm kind of just icing on the cake. But when you as a constituent say, this is how I feel about something, and you do so in a respectful way, then they pay attention to that. And now is the time. They are making budgetary decisions as we speak. Both the House and Senate proposals for appropriations have done well for the NIH and the research community in general. They have not done well in the House for CDC, by the way. And HIV is not doing well as we would like in a couple areas. Having said that, write them and let them know that we care about HIV/AIDS, that PEPFAR needs to be reauthorized, that it's important not to cut the research dollars for HIV/AIDS. But to put it in the broader context of research funding, research is important because remember that a lot of the discoveries in one institute amplify or augment discoveries in another institute. So research is very helpful because we build on that knowledge space over time. And if you do that today, they're making those decisions as we speak.
Yes, and want to just also add, I see in the chat, again, there's the 5calls.org, which makes it really easy to call your representatives to advocate for HIV research. One thing I will also say, it's also good to even, I know these have scripts, but if there's some way that you can sort of tailor it a little, put some like original, but accurate information about like yourself or your community, that also helps a lot, because sometimes they see like sort of form emails, they're like, okay, they're counting it. But I think what can really sort of connect is sort of hearing people's like personal stories and experiences.
Yeah. That's a good point. You can take that background, alter it a bit, and it's very helpful when you do that.
Absolutely. And that's also available through Research America's website. It's free to everybody, researchamerica.org. Don't use the exclamation point in the address, the web address. But that's exactly, I would just want to underscore how important right now it is to be in contact with your members of Congress. And you may feel that you want to write to 25 members of Congress, but the real influence you have is with your congressperson and your senators. And don't wait. It's not hard to do. Tell your story. Again, your story, not your data, your story about why it's important to you, why research is important to you, your life, your health, your family, your neighbors, whatever your story is. It's really, really important. And then get used to, Georgia said, do this in a respectful way. Thank that person for their service, even if you disagree with all or some or of their positions. They're still representing you, and they want to hear from you. One of the things we hear when we're working on the Hill with members of Congress, and some of my team do that work for sure, and occasionally I do too, is people who want to be champions for research of all kinds, but haven't really spoken up much. We say to them, what can we do to help you to be a champion? And the classic thing the member of Congress will say is, please urge your allies in my district or my state to get in touch with me and tell me what matters to them. I will respond. So we can't take it for granted that people who are already champions or want to be champions will continue to be so. We have to let them know how much it matters at home. And that is, of course, read correctly by them as that's a vote. It's a vote.
Mm-hmm. So. I think also the two things, and I completely agree with Drs. Woolley and Benjamin. I also think that just as you were saying earlier, Jim, about all things politics being local and research is local, well, so is your advocacy. The same way that we have to be talking to our U.S. federal Congress persons, our representatives inside Washington, we also need to be talking to our state legislators. We need to be making sure our governor's offices, that the administrations within our states are also hearing from us consistently and urgently now, because for two reasons. One, there are such things as state budgets, and there are state budgets that can go into research. And not only that, a lot of the federal dollars that have been usurped from current federal national funded research is going to the states. And so that's where the advocacy must also go into play, is with your local elected officials as well. And I also think in terms of localizing, and one thing that you can do is, if you know your person, if at any point you have been in contact or in communication with that person, try and get some time with them. Get on the phone, get in person, and call them in. We're not trying to cancel everybody. Some we want to cancel, but we're not trying to cancel everybody. We don't have to call out everything, as Mary was saying, in terms of what we don't agree with. But what we can do is call them in with our own expectations, with our own specific requests, with our own stories, with our own impacts, so that it can be heard and possibly felt in a different way than a voice or a name on an email or a voice on a voicemail. So be local. And be in person and be personal as much as possible with your story, but also with the effect and with what you want the other to feel, not necessarily only what you want them to do.
Yes. I've heard, staff have been, when people come in to the office and actually want to talk with their representative or their senator, they're shocked because they're not used to people doing that. So definitely, if that's something that's feasible. I do see Alice Sato. Alice had a question. Funding has not been restored equally in states that haven't joined lawsuits. We've seen less of our research and public health funding returned. How do we address this inequality? And anyone can take this.
Yeah, that is a challenge. And, the lawsuits have either been under the Democratic governors that sued under the NIH proposal in some cases, and then of course the APHA suit, which was broader, but still one had to be a plaintiff in the suit. Tragically, that's the situation we're in right now. Obviously, we're hoping that we can get some agreements to get the administration to see the folly of their ways, and hopefully they will begin to open up some of the research. But it's going to take a lot more work. We're going to have to get more courts to agree with us, and possibly we're going to have to make it to the Supreme Court to agree with us. So far, as you may know, where they have ruled primarily on procedural issues, but not so much on the merits of these cases. So we hope that when they get to ruling on the merits, because the other cases are still proceeding, even when they ruled in a procedure matter that has set us back, we hope that eventually the Supreme Court will rule in our favor on the procedural matters, but that remains to be seen. I mean, at the end of the day, we have to continue to make that case that diversity, equity, and inclusion doesn't just help people of color, or people who are looking at transgender or gay and lesbian individuals. Women are impacted by that. Rural Americans are impacted by that, and that just puts everybody at risk. I think we have to continue to make that case as loud and as public as we can in order to get them to listen.
Dr. Woolley, did you have anything to add to that?
I don't think anybody says it better than George's. Yes.
Yeah, I probably would just punctuate that with, this is a human rights issue. Mm-hmm. It is a human rights cause, and you do not need human rights law to put human rights into practice. Mm-hmm. And that's what I think is the intention with the research advocacy that's happening around DEI, because it is beyond diversity, equity, and inclusion. It is also about dignity. It is about justice. And those are the things that matter most to people for whom the research is supposed to matter the most.
Wow. Yes, you do. So you're just saying again what you said, you do not need human rights law to put human rights into practice. We can do that any day, at any moment. Dr. Woolley, I see you had your hand.
And just call me Mary. So a little bit of a jump shift to think about how to empower people who are in the research ecosystem, I mean researchers themselves, to engage more with community. Maybe a few words about that, and I'm interested in other folks' thoughts as well. Because what we really have to be pushing for is for academia in particular, but other places where researchers work, to value community engagement in ways that they, I knew you'd like that, Dazon, in ways that they really haven't. They've left it to one or two people or some office that's going to take care of it. Whereas really it's the researchers themselves that should be in the community listening, helping design studies that will serve the interests of that community rather than making a lot of assumptions that may be right, but also may be unfounded. And it will also encourage more participation from volunteers, and word of mouth will accrue to the luster, if you will, of research, which sometimes people are glad about. You know, people who aren't scientists, aren't science trained, they may be happy about research, but we know from commissioned public opinion surveys that for the most part, they don't know where research is conducted, they don't know who conducts it, and they don't know where to find out more, even though they'd like to. And although there are researchers who still believe, sorry to say, that publishing a paper in Nature or the New England Journal or somewhere else covers the territory in informing the public, who's paying the bills, by the way, that is not the case. That is not the case. So it has to be much more personal, and it has to be valued, explicitly valued by academia, including in the promotion and tenure process, but by each other as well within the community.
Let me add that a lot of our academic colleagues believe very strongly that the science speaks for itself. And the truth of the matter is, the science speaks loudly, but it doesn't connect the dots. And you have to connect the dots. You have to make sure people understand in the hood what this means to them in their daily lives. And we have to make sure policymakers understand the value of the research. You know, we've had members of Congress who ask, well, why are we spending all this money at the NIH? Isn't research done in the private sector? Well, the private sector, particularly commercial businesses, do research which is in their economic interest. Nothing wrong with that. They have stockholders. They have to speak for that. They're there to make money, but they're going to do what's in their interest. Federal research, our tax dollars, goes within the public's interest first. And we also have the ability to do more risky stuff, more cutting edge research, research that is more foundational, that the private sector cannot do or won't do. But they can then take it, build on it, and then commercialize it. And that's fine. So people have to understand that. I think the other thing is a lot of researchers, that quite frankly don't know how to talk to folks in the hood. And we have to help them, giving them the skills.
Indeed.
To go in and talk to folks in the neighborhood and not talk down to them, but have a conversation with them.
Right.
They put their pants on like we do. They put their dresses and shirts on like we do. Every morning they get up to take care of their kids, feed their families, and go to work. And we need to, researchers have got to not be afraid to go into the hood, and the hood has not got to be afraid to go talk to the researchers.
Mm-hmm.
That's it.
Mm-hmm. Yes. And
literacy.
Yes.
Yep.
And can I just say just really quickly, I feel like in HIV community and HIV advocacy in particular, community has been so instrumental in translating the science. I mean, I'm just thinking about just U equals U. I mean, that was, sort of held up within institutions and was not getting to the people. And community was like, no, we are going to make sure we get this to the people, and we're going to get it in Bruce Richmond, French and Access Campaign, many great folks out there who said, we're going to create a clear and simple message that communities can take, they can adapt to their context, they can use to advocate, whatever it is. So community is so crucial. And I think HIV advocacy has just shown how powerful community is.
You're so right. I'm sorry. I wanted to make sure we've been talking a lot about advocacy, and we've focused a lot on the domestic response today, which is important. But we know Triple D here has been doing a lot of work in sub-Saharan Africa, in South Africa, Southern Africa for a long time. And there's some amazing advocacy that has come out of Southern Africa for many, many years, and really leaders in so many ways. So can you tell us sort of what is happening now in terms of research advocacy on the ground and in South Africa in particular, which has extra challenges with the regime?
Yeah, so interestingly, the research on the ground has gone to the ground. I mean, for the last few decades, what we know is from, especially within sub-Saharan Africa, so much of the research dollars came from outside the continent, right? And so much of the advocacy was geared in that direction, whether it was in the public sectors of governments that were providing support for research on the ground, or it was private industry that was providing the support and the studies on the ground. And so that's where the advocacy was primarily focused. But now that so much of the need has gone local, the advocacy has ramped up with local governments, with national or federal institutions, and it's a different kind of challenge. It's a different kind of challenge because there are different vulnerabilities that people have to face on the ground. So I know in certain places there are folks who have gotten into some trouble. There are folks who are currently targeted. There are some people who are in legal matters and in legal situations. There are others who are shunned or who have been ostracized and in some cases blackballed from their invitations, from their involvement in the policy work and in some ways in the decision spaces around the research that's happening. But at the same time, that has not dampened the spirit. That you've had folks like Yvette Raphael and you've had Moses Supercharger on. These are continued voices that are still fighting the good fight and lifting up all of the areas of science that people of African descent worldwide, especially on the ground in sub-Saharan Africa, have changed the trajectory of all the possibilities for HIV and ending the epidemic. And so we also have to stand 10 toes down, as they say, in support and in solidarity with the work that they have to do locally in all the best ways we can. I want to make a special note of what you just said, Jim, just because I'm still such a proud observer and part of the witness to this process. One of the most positive successes we've had, at least from an HIV prevention standpoint, in decades, of course, is the new longer acting injectable that you can get for every 6 months. I want you to know that for women, this was a super duper win because it is one of the first true PrEP studies for which the success in women was unquestionable, right? Absolutely indisputable. And a large part of that success is because they started with community before the protocol was even written and made sure that community became accountability holders, not just advisors throughout the entire process. And that's why I'm going to say that's a large part of why you had a really good drug that showed the science worked, but the community has demonstrated how the science is important so that it doesn't just work, it means something.
Mm-hmm. Mm-hmm.
Yes, Triple D. I think everyone in the chat agrees with you. I'm seeing only that we're at our last 5 minutes. Do we want to have each speaker kind of give something to go home with? Like if you all had a nugget to take out, or you want us to take out into the world, one thing to remember. So you don't have a lot of time to say this. You have about a minute to say this. Can we get those golden nuggets that we can share?
One, I don't know if it's gold, but I do know that it works. That when people who are researchers, are in science, are talking to non-scientists, whether they're in the community or talking to their extended family, Thanksgiving dinner table, or to an elected official, the thing to say when somebody says, well, now what do you do? Or remind me what you do. What you say is, I work for you. I work for you, because you do. It's a little different talking to a member of Congress. What you say in that case is, I am like you, I'm serving the public's interest.
Mm-hmm.
But that I work for you is then an opportunity for the person you're talking to ask you questions. How do you do that? What do you do? Here's something more I'd like you to do. It really is easy to remember, and everybody could do it.
Thank you, Mary. Who's next? George?
Sure. During my medical career, we've gone from a disease in which we had no knowledge of what caused it to the fact is that today we have the tools to totally stop transmission of HIV/AIDS. We actually have the tools that know how to do this, but we don't have a cure. We need to finish the job.
Yeah. What I would add to that, George, is I think the tools are not only are they the key, but the troops are the solution. That's where we have the tools, but we also, because we always talked about we're fighting a war, we're fighting against HIV, we're fighting against an epidemic, which means we are warriors in every battle that we've entered, especially in the research field. And so now we make sure that we have the people to make those tools win the fight for us, right? So we need the troops, we need the folks, we need the advocacy members to grow. We need folks to know about everything that's happening as it's happening. We need folks to get engaged, make those phone calls to your congressional folks, make those phone calls to your state folks, but also make sure you're talking to your research folks to not give up, to not give in, to not give out, and to not give up on us as their partners in this charge and in this fight. Because this is the only way that we're going to win it is when all of our communities come together under this one huge rubric. I'm a proud member of Research America. I'm a proud member of APHA, and I'm a proud member of this whole community and this universe of research advocates to end HIV. And I'm grateful for this conversation today and the 24 hours to do it.
Wonderful. Thank you all so much for those very. Thank you so much for those wonderful just calls to action, those nuggets at the end. I know all of us are feeling energized and incredibly hopeful. Just seeing lots of comments in the chat supporting this. So just a big thank you. Jim, I don't know if you want to say anything else. I know we have to do a call to action in a minute.
Yes, so call to action, it's on the screen. Do it. All action is local. So click on, make your calls, but then find some work to do in your neighborhood. And I think before we turn it off to our next set of hosts, Oni, I just want to say this has been really fun working with you. Let's do it again.
Yes, we must.
What a great frickin' panel. Like George, Mary, and DDD. Everything has been great so far today, but you all have just made hour 5 like shine. So hour 6, here we come, and you got a big bar to beat.
Yes, and I think we're welcoming our next host, Mitchell Warren, who's back with us.